Delivering difficult news to a veteran is never easy, especially in matters of life and death. Many providers may not have been taught how to handle these delicate conversations. This training demonstrates how to deliver difficult information accurately with compassion. We recommend using an approach that follows the acronym SPIKES, which stands for setting, perception, invitation, knowledge, empathy, and strategy. Research has shown that providers feel more confident and patients feel more supported when using the SPIKES approach. In this program, you will watch a physician use the SPIKES protocol with a veteran nearing the end of her life. After watching this video, you should be able to describe the SPIKES protocol and to apply it to your practice. Make sure you also view our other video that applies SPIKES to delivering the diagnosis of Alzheimer's disease. By using SPIKES, we can communicate better and provide compassionate care to veterans.
Mom, you warm enough?
It's been 1 year since 74-year-old veteran Sarah Griffith was diagnosed with Alzheimer's disease. This is her third admission for pneumonia this year.
Hi, honey, here's your coffee.
Oh, thank you.
The nurse said the doctor will be in to see us soon.
Thanks.
The geriatrician, Dr. Maria Sanchez, has cared for Miss Griffith once before. Based on her current condition, Dr. Sanchez believes an end-of-life discussion is necessary with her family. Knowing this might be a difficult discussion, Dr. Sanchez prepares for the meeting by reviewing the SPIKES protocol. First, she takes care of the setting by securing a private meeting room that's comfortable with enough seating to accommodate the family and includes a tissue box. Setting also includes a thorough review of the veteran's medical records. To be totally attentive to the veteran's family, Dr. Sanchez gave her pager to a colleague and turned off her cell phone so she will not be disturbed during this important talk.
Think she's any better?
No. Yeah, they just took her food tray. She didn't seem much interested at all.
Nothing, huh?
No.
You think her feet are warm enough?
Yeah,
Hello.
just put some socks on. Hi.
Hi, I'm Dr. Maria Sanchez.
I'm Catherine, her daughter. This is my husband, Pete.
Nice to see you again. I remember meeting you all when I cared for your mother during her last admission.
Yeah, I remember meeting you. Well, my mom's having trouble breathing again.
And she's not really talking or eating much.
Yes, that's right. I've been reviewing your mother's medical record. Why don't we meet in the family meeting room and we can talk about her care?
Sure. Mom, I'll be right back.
Great. I'll just head down the hall. Here we are. Have a seat, please.
Notice how Dr. Sanchez arranges the seating to ensure eye contact with the family members. Now it's time for the perception phase of the SPIKES approach. Dr. Sanchez will ask the family their perception and understanding of the medical situation.
So, how do you think your mother's been doing?
Well, she hasn't really been the same since the last hospital stay. And she barely eats, no matter how much I encourage her.
She speaks to us very little. She just sleeps most of the time. I don't think she even knows that she's in the hospital.
Yeah, and if you knew my mom when she was young, she always had a story to share, and she was just so fun-loving. Not anymore.
Does your mother have a living will that'll help us know her wishes for her care?
No, I wish she had one. Thankfully, though, we talked about her end-of-life care a few months ago. But I didn't know it would be this hard when the time finally came.
So what do you think your mother would want knowing that her health is failing? I guess I'm asking you to speak from her perspective.
Well, before we make any decisions, can you tell us why you think the fluid is filling up in her lungs?
Yes, most definitely.
Now it's time for the invitation. Ask about how much they want to know about the medical status.
Well, along with having cared for your mother before, I also reviewed her medical record and evaluated her today. I want to share with you my understanding of her condition and how she's doing. Is that okay?
Yes, please share details so we can understand. The more we know, the more comfortable we'll be with making decisions.
I agree. More is better.
You had asked about the fluid in your mother's lungs. Yes. We ran several tests.
Now that the family has accepted the invitation, you can move into the next step, providing knowledge.
As you've noticed, your mother's gotten weaker since her last hospital stay. My opinion is there's little chance of her condition improving, even if we can treat this pneumonia. I know this may be difficult to hear, but it may be time to think about options since her health is declining.
You think she's dying?
I'm sorry to say, but yes. Have you considered options for her care? For example, we could continue treatment, yet we would need to talk about the possibility of do not resuscitate or intubate status, or the possibility of your mother entering into hospice care.
Really? Hospice? But isn't that like giving up on her?
I know I just gave you a lot to think about. Hospice is just one of the options. Hospice is really about providing your mother comfort at the end of her life. The hospice team could work with your mother, you, your family. They could also help manage your mother's physical needs, keep her comfortable, and provide her with spiritual support. The care can be at home or elsewhere.
Depending on how much knowledge is needed, move into the empathy stage in helping the family come to terms with the dying phase of their loved one.
Like I said, I'm asking you to make some difficult decisions that require you to think from your mother's viewpoint. Would she prefer intensive treatments in the hospital? Are there some treatments she may want but not others? Would she prefer only comfort care such as hospice?
I knew this day would come. She's really dying.
So what do we do?
Maybe you would like to talk with your family first and think through what we discussed?
It's been rough losing my mother with the Alzheimer's, but to think of not having my mom at all. Thank you.
While continuing to be a good listener and being supportive, this would be a good time to move to strategy, supporting the family and providing next steps.
I know there's a lot to consider and think through with your family. Here's some information that might be helpful to understand your options. I've included my office and nursing unit numbers. Maybe we can plan to talk in the next 1 to 2 days. I'll have our social worker available to meet with us when we get together again. And please call and confirm the meeting with me.
Sure.
Let's discuss it with the rest of the family and we'll let you know.
Most definitely.
We all want what's best for Mom, so thank you.
You're welcome.
Breaking difficult news can be hard, but now there's a protocol to make the process easier. As you saw in the setting part of Spikes, make sure to review the veteran's records and be ready for questions. Start by minimizing distractions so you will be totally attentive to the family. When possible, use a quiet, comfortable room to have the discussion. Remember, being seated is more calming. Silence and repetition are helpful as well. P is for perception. This step is the before you tell, ask principle. What does the family know about the veteran's condition? And how do they view the seriousness of the condition? Questions help to clarify what the family already knows about the illness. I is for invitation. Although most want to know details, you can't always assume that. Asking permission respects the veteran and the family's right to know. Knowledge is where the information is conveyed compassionately. Before you break difficult news, give a warning like, "I'm sorry to have to tell you," or, "Unfortunately." This helps prepare the veteran or family member for the difficult news. Make sure to keep out medical jargon, speak in lay terms, and deliver the information in small amounts. Then, follow knowledge with empathy. Sharing the emotional side is probably the most difficult. Share facts with understanding and compassion. Then follow up with strategy, establishing a plan for the next steps. Help the family or veteran understand the situation and come to terms with the news. Allow time for questions and make sure they know the next steps. Indicate how the family can reach you. Knowledgeable veterans and family members are better equipped to follow through with recommendations. Although delivering bad news can be challenging, you now have the tools to help a veteran and family through a difficult time. A compassionate approach shows the veteran and their family that you genuinely care. Also, please watch the other video on how to deliver a diagnosis of Alzheimer's disease using the SPIKES process.